Okay, so how you doing, guys? So, fill us in. What brings you in?
I sprained my ankle last year. So it'll be a year, almost in a month or so. Nothing has helped. There was no fracture, but tried PT, tried all kinds of things, pain medication, nothing has helped. And I decided to come see you because you helped my mom.
Okay,
Yep.
thank you. And during the consultation earlier, we also discovered that you've been having a lot of energy issues. You've been feeling very fatigued all the day.
Yeah, very sluggish. The feeling of sluggishness, really hard to pick up and just keep going. I'm a mom to a 2-year-old and I can barely keep up with her, which is not me. I'm generally a high energy, high intensity person, and also have had chronic digestion, constipation issues. Nothing that ever needed medical intervention, but that I just thought, oh, this is how my system is. But I now realize that it's not normal to have constipation issues and digestion issues and low energy, fatigue constantly. So, yeah.
So we're going to start off with instrumentation, and we're looking for a temperature difference. So next thing we're going to do is start a palpation and also visualization. We're going to check for is there any presence of any swelling, edema, muscle spasms. So already right off the bat, I see a significant amount of swelling right in this region, right over here. Okay, and also quite a bit of swelling right in this region over here. Okay, so we're going to take a look, see what's going on. Okay. So right now the muscles are tight on the right side compared to your left side. You feel that difference there? Okay. Let's see what else is going on here. So again, over here, muscles tight on the right side versus your left.
Yeah.
Okay. And nothing else is going on. Okay. Now we're going to start off with motion palpation, and we're going to check what's fixated and not fixated. So normal, it should move. Abnormal, it's going to be stuck. Okay. So first things first, we're going to check how's your foundation. Feel how much difference it moves?
Yeah.
The right side moves, the left side's stuck. It's a brick wall. Now let's check your left hip. Moves forward and backwards without a problem. Makes you somewhat stuck forward, but not too bad. Okay. You're forward, backwards without a problem on the right hip. Left hip slightly stuck forward, no problem going backwards. But this sacrum, no doubt about it, it's stuck on the left side. I'm going to check. You feel how stuck this is?
Yeah.
Okay, there's no movement here whatsoever. Everything's very rigid.
Yeah. It's better up here.
So everything in here is moving, whereas here it's very rigid. Okay. So the reason why it's rigid is because this foundation over here is misaligned. Okay. So because it's shifted out of alignment, it's causing a lot. You basically lost a lot of the biomechanical springiness over here. Okay. In this X-ray structural analysis, as we can see, her foundation, the sacrum right over here, angle is right over here. Normal, it should be here. That's the reason why you see the significant deviation in her entire spine. In addition to, we also identified other structural abnormalities at the 1st lumbar, 6th dorsal, and 7th cervical. Now, at this very first visit, we're going to take a conservative approach, rebuild her foundation and the 1st lumbar, and the other 2s, we'll keep an eye on them on the future visits.
Oh!
I know. Hold it right there.
Oh!
Just breathe. Just breathe. I know it's intense. Just breathe. Okay, you feel how springy this is now? Okay, much more springy.
And it doesn't feel tender. Like last time you did it, I was like, oh.
Yeah.
I don't feel that now.
Good. In this foot structural X-ray analysis, normal, I want to see all these structures in proper alignment. However, because there's bony protuberance from the talus, okay, this is the keystone for the arch, what I see is this. the talus should be here. Instead, it tilted anterior and superior. Therefore, this is the one we need to correct on her. So first things first, we're going to check your talus. Okay. See that difference already? Okay. I could swivel your talus to the outside, inside.
Yeah, and I feel it crack when you do that.
And see on the left side, I could easily go on the inside. See over here? I could easily swivel it both directions. Not a problem. Whereas over here, inside, I'm sorry, outside, see?
Yeah, it's stuck.
Yeah, right there, it's stuck, doesn't move. So already, what we could tell, okay, this structure right over here on her, okay, when we try to test it and move it, okay, we could easily swivel this way. We just can't swivel it down this way. So this one on her is misaligned by going this way and also unable to swivel that way. So that's the one we need to correct on her. Lifting, huh? So let's see what else is going on, okay? So we're going to check right now. Tibia, tibia. No problem. So calcaneus moves fine. You just sprained this one too?
No.
This one feels like it's sprained a long time ago.
Okay. It's possible. I mean, I used to skate when I was younger and lots of falls and such.
Okay, right now everything is moving fine. Okay, so the only thing we need to fix right over here is just the talus.
Physical therapy for ligament tear and all of that is secondary. We need to first fix the structural issue.
The structure itself.
That's why 1 year of physical therapy hasn't really helped enough.
Well, there is a limitation to physical therapy.
Right.
Okay, it makes a lot more sense first correct the structure. Okay?
Gotcha,
Put it in proper alignment, then do physical therapy.
Okay, okay. Yeah, that makes sense. Okay.
Because there's only so much you can strengthen, okay? Because the ligament itself is not a conscious ligament. In other words, we don't simply say, hey guys, clench. No.
Yeah.
It's completely subconscious. Okay?
Yeah.
So as much you could do with physical therapy, there's a limitation. So if there is a significant misalignment, and that's what we see on the structural X-ray itself, then yeah, you could do all the physical therapy in the world, okay? It's going to have very limited effect on this fellow.
Okay.
I'm not saying it's not going to have no effect. No, it has some effect. It's just not effective enough in this particular case.
Right, okay, gotcha.
Okay, so let's go. First things first, we're going to pump it up. Anterior Superior Medial Talus. Okay, that's it. Walk around. You felt that tiny little click in there?
Yeah, yeah.
Okay.
Oh my goodness. You remember how I said it feels like a nut or a bolt is missing and that the foot is clunky? It doesn't feel like that. Wow, I haven't felt this in a year.
That's something? And it wasn't
Is
even
that real? Like, wow. And it doesn't hurt here anymore. Remember I said this is where it used to hurt and this part? It doesn't hurt anymore. It was numb when I came here today for the appointment. Is this for real?
It's real. You're not dreaming it. You're wide awake for this one.
Oh my goodness.
See? Specific correction makes all the difference in the world.
Yeah. Yeah, I can tell there is some soreness here still, but
It's
not
take
painful.
time.
It's not. Yeah, it doesn't feel like I have to walk like gingerly just because it feels off. I'm not. I'm just walking. This is cool. Thank you.
Oh, you're welcome. So this thing, I'm gonna let you know. Okay, it's gonna hold for a couple of days. It's gonna swell up again.
Oh,
Okay, because your body says, "Oh, wait a second. This is finally proper alignment." Then what the heck is going on over here? Okay, so this is a defensive mechanism. Okay, it's trying to protect it. It's an airbag that just inflated up, trying to stabilize that thing. Okay, So the magnesium sulfate will help reduce the swelling, help repair the ligaments. Okay, because the ligaments they're slightly damaged, meaning you really stretch your limit.
Right.
And you're trying to relax it. But that's trouble doing so because this keystone was significantly rotated and misaligned. Okay, so that's why you're feeling what you're feeling right now. Okay, so all we do is just gently put it back in place. Okay, and now it's gonna now. Actually, now this, if you still remember your physical therapy exercises.
Yeah.
Yeah.
Now's
Now,
the time to do it.
right.
Okay.
Not now.
Gotcha.
You're gonna start doing it. I say about 2 weeks from now.
Okay.
You're gonna start doing that.
Okay.
Then it's gonna feel stronger and stronger and stronger.
Okay.
Okay.
Awesome.